Good day, everyone. By the way, I am Shalome Mocas, together with my groupmates Faye Pelaga, Hannah Jane Paladin, Micah Era Esteban, and Rain Jason Lagetao from Bachelor of Secondary Education major in Social Studies. Today, we're gonna talk about the chapter 2, which is physical and sexual self, as part of our subject Understanding the Self. So, before we'll proceed, we have learning objectives. At the end of the lesson, you'll be able to define what is physical self is, discuss the different views of one's physical self, determine the factors that influence the change of view of one's physical self. Next, explain human sexual behavior. Differentiate natural and artificial method of contraception. And the last one, we have to describe sexually transmitted diseases. So, when we say physical self, what is physical self is? Okay, let Micah R. Esteban explain about that.
Good day to you, ma'am. I'm Micah Era G. Esteban, and now I am going to discuss about the physical self. When we say physical self, it refers to the body, the individual's perception of themselves in areas of physical ability and appearance. It is undeniable that each of us have different perceptions in oneself. Each of us have what they called physical ability and appearance. Physical ability includes concepts such as physical strength and endurance, while appearance refers to attractiveness and body image. Physical self is a concrete dimension, the tangible aspect of the person that can be directly observed and examined. A positive view of self includes understanding that healthy, attractive bodies comes in many shapes and sizes. Every person is unique, and the beauty is appreciated differently. It varies from time, culture, and various perceptions about the world. Well, physical beauty is important. Our character or value as a person is still much to count on. The physical self is a significant component of one's image and personality. Though we would not perfectly fit with the golden ratio, being clean, hygienic, and having a proper attitude in social situation create a good image and makes one feel good about the self. Body image is how we view our physical self, including whether we feel attractive or whether others like our looks. For many people, especially people in their earlier teens, body image can be significant and it can be closely linked to self-esteem. Yes, it is true, because as I have observed people nowadays, body image is more important for them. They exert more effort just to look attractive and look good.
Next, the following are the ways of taking care of the self. So, how to take care of the skin? First, take a regular bath or shower. Number 2, apply deodorant. Next, avoid oily food. Prevent acne facial cleaning. Sleep at least 7 to 8 hours a day. It is very important. Drink 8 glasses of water each day. Number 7, avoid too much exposure to sunlight. Number 8, take vitamin C and A. Avoid cigarettes. And the last one, use facial lotion to hydrate the skin. Next, how to take care of your hair. First, brush or comb hair at least twice a day. Wash hair every day with gentle soap or shampoo. Next, use enough hair conditioner. And number 4, have an intensive treatment at least once a week. Use your own comb. The last one, trim hair at least once a month to get rid of split ends. How to maintain contagious smile. First, maintain a regular oral care. Brush teeth after meal and before bedtime. Use mouthwash. Number 4, maintain a healthy diet. Avoid sugar. Have a regular dental checkup. The last one, avoid cigarettes in order to maintain contagious smile. For good grooming, for gentlemen, be clean, take a shower, cut nails and pamper skin. Select the right wardrobe for the right event. Have a sense of style. Wear clothing that feels comfortable but elegant. Number 4, wear clean and shiny shoes that complement your style. And also check your bearing. Proper body posture adds confidence and appeal. For the ladies, think about every day in order to be clean and fresh as it exudes confidence. Next, polish nails to add femininity and art. Number 3, apply light makeup using colors that match your skin tone. Choose the appropriate attire that suits the event. Use mild feminine perfume scent that suits your personality. Next, wear clean shoes or sandals. Number 7, choose the best bag or clutch that complements your clothing. Bring only essentials in your bag. And the last one, wear a smart faced chain up and keep proper smart posture. Next, smoking etiquette. First, use an ashtray. When you smoke, use an ashtray. Butanganan sa abo or upo sa sigarilyo. Number 2, put out on the stub. Number 3, never throw cigarette butts on the floor. Ay, bisag asa, ilabay ang upo sa sigarilyo. Never smoke when walking. Never smoke in public vehicles. The last one, be courteous to those who are sensitive to smoke.
Drinking etiquette. First, be pleasant. Second, drink in moderation. Third, drink slowly. Do not mix drinks. Drink coffee for hangover. And the last one, call it a day when you have enough.
Dating etiquette. First, give a gift to your loved ones. Number 2, learn to appreciate and compliment. Do not embarrass the person if you do not like him or her. Do not stay late. And number 5, it is the most important. Inform your parents wherever you go. Do not tempted to drink, take drugs, or do sex. Control yourself. Don't overspend. And the last one, plan ahead. Party etiquette. First, plan ahead. Make good food. And number 3, don't over-decorate. Dress up well. Receive guests personally. Be hospitable. Next, be on time. Make new friends. Eat moderately. And number 10, do not overstay. The last one, thank the host or hostess.
And the last one is phone etiquette. First, when someone calls you, learn to greet is very important. And second, identify yourself. Third, modulate your voice. Fourth, caller should end the call. Then be accommodating. Avoid negative statement. When someone calls you, let the speaker finish his or her line. And the last one, say thank you and goodbye. It is very important.
Okay, now we will proceed to the next topic, which is sexual self. Let Ms. Faye Palaga explain about that.
Hello everyone, good morning. I am Fe Pailago from Bachelor of Secondary Education, major in Social Studies, we are the group 5 and we are assigned to report about physical self and sexual self. But before that, I want you to give your perception about sexual self. What is sexual self in your own opinion? Sexual self, it talks about sex. Another perception. When we talk about sexual self, it is an individual's evaluation of his or her own sexual feelings and actions. It means that what we have feel or what are the feelings and actions when we having sex with our partners. If we are having sex, we can feel the pleasure and happiness. Alright, now let's move on to the 3 dimension of sexual self. The first dimension is sexual openness. So when I say sexual openness, it is the ability to take directly about sexual matters and to learn about and participate in mutually agreeable sexual activities with a consenting partner. In short, that people who are open-minded approach new things with curiosity about and tend to seek out novelty. Men and women high in openness are more well-informed about sex, have wider sexual experience. Okay, let's move on to the second dimension, which is all about sexual esteem. So when you hear the word esteem, what comes on your mind? Okay, it's a confidence. Okay, sexual esteem is the feelings we have about our body and confidence level in how we relate intimately to someone else. Okay, for example, you have a boyfriend and then he wants you to sex with him. You are very confident because you know yourself that you are still a virgin. However, if you have been physically or emotionally abused, like sexually harassed or embarrassed, then your sexual esteem may have suffered. Last but not the least, the third dimension is sexual anxiety. Sexual anxiety, it can be caused by negative experiences from the past. Okay? For example, if a woman suspects that his partner is unfaithful, she may feel inadequate, angry, and less inclined to have sex.
Okay, in addition, it has been believed that the sex chromosome of human define the sex, which is female and male, and their secondary sexual characteristic. So, our sex determined by the combination of the chromosomes. We have the XX for female and XY chromosomes for male. However, there are the individuals who do not accept their innate sexual characteristic and they tend to teach their sexual organs through medication and surgery. Aside from our genes, our society is one of the factors that will transform our sexual behavior and thus help us understand on the development of sexual characteristic and behavior. Next, human sexual behavior. Okay, what is human sexual behavior? Human sexual behavior. Any activity solitary means between two persons or in a group that induces sexual arousal. It is the way people experience and express themselves sexually. This involves biological, erotic, physical, emotional, or spiritual feelings and behavior. The biological and sexual aspect of sexuality largely concerned the human reproductive function, including human sexual response cycle. So we have the two major factors that determine human sexual behavior, which is inherited and influenced. The inherited sexual response, patterns that have evolved as a means of ensuring reproduction and death are part of each individual's genetic inheritance. The degree of restraint or other types of influence exerted on individuals by society and expression of their sexuality. Next, we will present the natural and artificial methods of contraception. So, what is natural method? The natural method of contraception is called natural because it does not rely on hormones or any devices. It just simply relies on the observation of one's body, most particularly woman's body and her cycle. Okay, the following are the example of natural method. First, abstinence. Abstinence is a natural method that involves abstaining or declining from sexual intercourse. This is considered the most effective natural birth control method with an ideally 0% fail rate. Next, calendar method. Calendar method is also called the rhythm method. This method of family planning involves refraining from coitus during the days that the woman is fertile. The fertility of woman is the time of ovulation, which usually occurs 12 to 14 days before the next period starts. However, this does not mean that after menstruation, there is the chance of getting pregnant. Next is basal body temperature or BBT.
Hi everyone, good day. I am Hannah Jane E. Paladin from Bachelor of Secondary Education, major in Social Studies. Basal body temperature or BBT is the woman's temperature when she is fully at rest. BBT falls at 0.5 F before the day of ovulation and during ovulation. The woman must take her temperature early every morning before any activity, and if she notices that there is a slight decrease and then an increase in her temperature, this is a sign that she has ovulated. The woman is most fertile during the 2 to 3 days before her temperature rises. So, diri sa basal body temperature is need gyud sa mga babae nga mag-take og temperature labaw nag kargado kay ka sa pahuway, then aya sa adlaw sa imong ovulation and or during ovulation, kinahanglan ang bayi jud is mag-take og temperature early every morning or sayo sa kabuntagon before ka magdo or aya ka magdo og any activity. And if maka-notice ka or makabantay ka nga na slight nga ni ubos or ni taas ang imong temperature, muna na siya sign nga nag-ovulate na siya. And then, if ang bayi is mag-fertile, maabtan pa siya og 2 to 3 days before or ayha ang imong temperature mataas. So, let's proceed the fourth example about cervical mucus method. Is based on the observations of the changes into cervical mucus during ovulation. To check if the woman is ovulating, the cervical mucus must be coffeous, thin, and watery. This kind of environment helps the sperm travel through the cervix, uterus, and fallopian tubes to the egg. So, there is a cervical mucus method is gabase ra siya sa iyang own observation of the changes in the cervical mucus. So next, symptothermal method is a combination of BBT method and the cervical mucus method. This is one of the most trustworthy natural family planning because it incorporates several signs of the woman's fertility. The beginning and the end of the fertile period is determined by the cervical mucus, cervix changes, and changes in morning temperature. So, kani siya nga method guys is combination ni siya sa BBT method and the cervical mucus method. Ovulation detection method. It is an over-the-counter kit that can predict ovulation through the surge of luteinizing hormone that happens 12 to 24 hours before ovulation. It is a kind of home test that detects the rise of the LH in the urine, which is a signal to the ovary to release the egg. So guys, here is the last but not the least about coitus interruptus. It is the oldest method of contraception, also known as withdrawal or pull-out method. The couple still proceeds with the coitus, but the man withdraws the moment he emits semen, it outside of the female reproductive organ.
And now we will proceed to the samples of artificial method. First, we have contraceptives. Contraceptives, commonly known as the pill. Oral contraceptives contain synthetic estrogen and progesterone, which is taken by women. Estrogen suppresses the follicle-stimulating hormone and luteinizing hormone to suppress the ovulation, while progesterone diseases the permeability of the cervical mucus to limit the sperm's access to the ova. Next, transdermal patch. Transdermal patch has a combination of both estrogen and progesterone in the form of a patch. It is a safe and convenient birth control method that works well if the woman uses it correctly. The hormone in the patch stops the woman's ovulation, so there is no egg for the sperm to fertilize. Next is vaginal ring. Vaginal ring is a small, soft, plastic ring that women place inside the vagina. The ring releases a combination of estrogen and progesterone and surrounds the cervix. The hormones in the ring stop the ovulation and thicken the cervical mucus that blocks the sperm from swimming. Most of the vaginal ring is replaced every month. Subdermal implant. Subdermal implant is a long-term birth control option for women. It is a rod-like implant similar to the size of a matchstick that is embedded into the upper arm right under the skin during her menstruation or in the 7th day of her menstruation to make sure that she is not pregnant. It is effective for 3 to 5 years. Next is hormonal injection. Hormonal injection, it is a shot or injection given to women to stop the body from ovulation or releasing the egg, and causes changes in the endometrium on the cervical mucus. Next is intrauterine device, or simply known as IUD. It's a small T-shaped object that is inserted into the uterus via female reproductive organ. It prevents fertilization by creating a local sterile inflammatory condition to prevent implantation. It is effective for 5 to 7 years. Next is chemical barriers. Chemical barriers such as spermicides, vaginal gels and creams, and glycerin fumes are used to cause death of sperms before they can enter the cervix, and also lower the pH level of the female reproductive organ so it will not become conducive for the sperm. Also, we have a diaphragm. Diaphragm works by inhibiting the entrance of the sperm into the female reproductive organ. It is a circular rubber disc that fits the cervix and should be placed before coitus. It has to be used with a gel that kills the sperm. It has to be changed every 2 years or when the woman gains or losses of more than 15 pounds. Next is cervical cup. Cervical cup is another barrier method that is made of soft rubber and fitted on the rim of the cervix. Its shape is like a tumble with a thin rim and could stay in place for not more than 48 hours. It is reusable that is inserted in the vagina with spermicide before coitus to prevent pregnancy. Next, male condoms. Male condoms is a latex or synthetic sheet that is placed on the erect male reproductive organ before penetration in the female reproductive organ to trap the sperm during the emission of semen. Female condoms are internal condoms, also latex rubber sheets that are specially designed for females and pre-lubricated with spermicide. Surgical method. Surgical methods can be done for both males and females. Males undergo vasectomy, which is executed through a small incision made on each side of the scrotum. The vas deferens are tied, cut, or plugged to block the passage of the sperm. In women, tubal ligation is performed by occluding the fallopian tubes through cutting or blocking the passage of both the sperm and ova. Okay, Rangers and Lagita explain about that.
Sexually transmitted diseases. Sexually transmitted diseases or sexually transmitted infections refer to the condition where one person passes the disease or infection to another person through sexual contact or unprotected oral, anal, vaginal sex. This does not mean that sex is the only way of transmission, but this can be passed also through the sharing of needles and breastfeedings. Symptoms of STDs. It is possible to contract STDs without symptoms, but the common symptoms are pain or discomfort during sex or urination, sores, bumps, or rashes around genitalia, anus, buttock, thighs, or mouth, unusual discharge or bleeding from the genitalia, and painful, swollen, or itchiness in or around the genitalia. And now, let's proceed the common types of STDs. Number 1. Chlamydia. It's caused by a certain type of bacteria. It is the most commonly reported STD among Americans, as reported by the Centers for Disease Control and Prevention, that there are 1,508,354 cases of this kind. The case count corresponds to a rate of 497.3 cases per 100,000 population, with an increase of 4.7% compared with the rate in 2015. Many people with chlamydia have no noticeable symptoms. When symptoms do develop, they often include pain or discomfort during sex or urination, green or yellowish discharge from the penis or vagina, and pain in the lower abdomen. Chlamydia can easily be treated with antibiotics, but if left untreated can lead to infection of the urethra, prostate gland or testicles, pelvic inflammatory disease, and infertility. If a woman gets pregnant and has an untreated chlamydia, she can pass it to her baby. During birth, the baby may develop pneumonia, eye infections, and blindness. And the second, HPV, or human papillomavirus, is a virus that can be passed from one person to another through intimate skin to skin or sexual contact. There are many different strains of the virus, and some are more dangerous than others. The most common symptoms of HPV are warts on the genitals, mouth, or throat. Some strains can lead to cancer like oral cancer, cervical cancer, vulvar cancer, penile cancer, and rectal cancer. There is no treatment for HPV. However, HPV infections often clear up on their own. There is also a vaccine available to protect against some of the most dangerous strains. And the third, syphilis, is another bacterial infection. If often gas unnoticeable in its early stages, the first symptom to appear is a small round sore known as a chancre. It can develop in the genitals, anus, or mouth. It is painless but very infectious. Later symptoms can include rash, fatigue, fever, headaches, joint pain, weight loss, hair loss. If caught early, syphilis can easily be treated with antibiotics. But if left untreated, syphilis can lead to loss of vision, loss of hearing, loss of memory, mental illness, infections of the brain or spinal cord, heart disease, and even death. Fourth, HIV. HIV can damage the immune system and risk the risk of contracting other viruses or bacteria and certain cancers. If left untreated, it can lead to stage 3 HIV known as AIDS. But with today's treatment, many people living with HIV don't ever develop AIDS. In the early stages, it's easy to mistake the symptoms of HIV with those of the flu. Early symptoms are fever, chills, aches and pains, swollen lymph nodes, sore throat, headache, nausea, and rashes. These symptoms typically clear within a month or so since it is like that of flu. From the point onward, a person can carry HIV without developing serious or persistent symptoms for many years. In HIV, there is no cure for yet, but treatment options are available to manage it. Early and effective treatment can help people with HIV live as long as those without HIV. Fifth, gonorrhea, also is known as the clot, is another common bacterial STD. Many people with gonorrhea develop no symptoms, but when present, symptoms are a white, yellow, big, or green color discharge from the penis or vagina, pain or discomfort during sex or urination, more frequent urination than usual, itching around genitals, and sore throat. Since gonorrhea is a bacterial infection, it can easily be treated with antibiotics, but if left untreated, can lead to infections of the urethra, prostate gland, or testicles, pelvic inflammatory disease, and infertility. If this is passed into a newborn during childbirth, gonorrhea can cause serious health problems in the baby. Public lice are tiny insects that can take up residence in the pubic hair. Like lice and body lice, they feed human blood. Common symptoms are itching around the genitals or anus, small pink or red bumps around the genitals or anus, low-grade fever, lack of energy, and irritability. The lice or the tiny white eggs can also be seen around the roots of the pubic hair through a magnifying glass. If left untreated, pubic lice can spread to other people through the skin to contact or shared clothing, bedding, or towels. Treatment for this is an over-the-counter topical treatment and tweezers to remove from the body. It is also important to clean clothes, bedding towels, and home. 7. Trichomoniasis or trich is caused by a tiny protozoan organism that can be passed from one person to another through genital contact. Symptoms of trich are discharge, burning or itching from the genitals, pain or discomfort during urination or sex, infrequent urination. In women, discharge often has an unpleasant or fishy smell. Trich can be treated with antibiotics, but if left untreated, it can lead to infections of the urethra, pelvic inflammatory disease, and infertility. And the last, herpes. Herpes is the shortened name for the herpes simplex virus. Herpes is a very common STD and can be transmitted sexually. In the United States, according to CDC, estimates of more than one out of 6 people is just 14 to 49 herpes. Most symptoms of herpes are blistery sores. In the case of genital herpes, these sores develop on around the genitals. In oral herpes, they develop on around the mouth. Herpes sores generally cross over and heal within a few weeks. The first outbreak is usually the most painful, which becomes less painful and frequent over time. If a woman has herpes while pregnant, she can potentially pass it to her fetus in the womb or to her newborn infant during childbirth, also known as congenital herpes, which can be very dangerous to newborns. At present, there is no cure for herpes, yes, but medications are available to help control outbreaks and alleviate the pain of herpes source. This medication can also lower the chances of passing herpes to the sexual partner.